following us today to click raise hand icon.
The rate of decline in most regions has slowed, and every region has countries that are seeing a rapid increase in cases and deaths. In Africa, the number of cases and deaths increased by almost 40% in the past week, and in some countries, the number of deaths tripled or quadrupled.
And ask questions in 6 UN languages.
In April, WHO issued a call for expressions of interest to establish technology transfer hubs for COVID-19 mRNA vaccines. Tech transfer hubs are training facilities where manufacturers from low and lower middle-income countries can receive training in how to produce certain vaccines and the relevant licenses to do so. mRNA technology has been in development for decades and is the basis for at least 2 safe and effective COVID-19 vaccines.
WHO Director General, we have Dr. Emmanuel.
Today, I'm delighted to announce that WHO is in discussions with a consortium of companies and institutions to establish a technology transfer hub in South Africa. The consortium involves a company called African Biologics and Vaccines, which will act as the hub both by manufacturing mRNA vaccines itself and by providing training to a second manufacturer called BioVac. In time, Afrigen could provide training to other manufacturers in Africa and beyond. The Africa Centers for Disease Control and Prevention will provide guidance through the Partnership for African Vaccines Manufacturing. WHO is facilitating this effort by establishing the criteria for the technology transfer, assessing the applications, developing standards, and providing ongoing support and training. We are now in negotiations with several companies that have indicated interest in providing their mRNA technology to the hub.
Lead on ACT Accelerator, Dr.
Because today marks an important milestone towards the achievement of one of the critical objectives of the African Union's Agenda 2063, the Africa we want. The ability to manufacture vaccines, medicines, and other health-related commodities will help put Africa on a path to self-determination. Through this initiative and others, we will change the narrative of an Africa that is a center of disease and poor development.
Minutes to take any questions.
And we from Africa have been calling for the capability, the capacity that needs to be transferred to Africa so that we can also make our own vaccines. It's been shown now that we just cannot continue to rely on vaccines that are made outside of Africa because they never come, they never arrive on time, and people continue to die. And we've therefore called on the waiver, as I spoke about, but also technology transfer. So this is a phenomenal step, but it is a step that needs to be taken as we move to the realization of what we've proposed, which is the waiver of the TRIPS IP.
Access to medicines and health products here at
Cette initiative est la première de nombreuses autres. Nous continuerons à soutenir celle-ci avec nos partenaires européens, avec toutes les bonnes volontés, réunis par la conviction que l'action pour les biens publics mondiaux est le combat que ce siècle doit porter et le combat qui ne peut pas attendre.
So the timelines of when vaccines can be produced in the country will depend on whether there's a tried and tested technology that can be much more easily transferred to the facility in South Africa, which, by the way, already exists. There's already a pilot plant there, so all we would need is to put in some equipment and then train the workforce there locally on this the new process. Of course, sourcing all the raw materials and things that are going to be needed for this. in that situation, we could even expect to see within 9 to 12 months vaccines being produced in Africa, in South Africa.